Hey y'all, just getting ready for the day. Okay, so if someone gets a breast reduction, so I misunderstood this question initially. So on the lines of, let's say you're getting a breast reduction, and in the surgery or in any surgery, something is awry, something looks strange, or maybe you send to pathology and you notice something abnormal. Do you stop or keep going? That's a hard question to answer. Like, it's not a black and white answer. So to preface that, usually, let's talk about breast reduction. So usually for a breast reduction, I usually, if the patient's over 40 or very close to 40, I'll actually get a mammogram before surgery so that we can just kind of see and make sure there's not any abnormalities, etc. Right? So we actually do that before surgery to look and see. So I've been doing this for a while, and I've actually never been in a situation where I've had to stop a breast reduction because something was so abnormal, if that makes sense. The other thing too is that usually I will actually check, someone comes in for a consult, I'll do a physical exam. So, I examine the breast, I'll feel the breast, I actually feel the axilla as well to make sure I don't feel any masses or anything like that. So the goal of that is to limit surprises, right? Now, I have had actually two situations where it's not all breast reductions. I usually I send anytime I remove breast tissue, I send it to pathology. Why? Because the incidence of breast cancer is 1 in 8 women. So it's not like a super rare abnormal thing, and it's just a safety precaution. But anyway, so I've had two women where I've sent it. Now, when you send something to pathology in the operating room, you can send it as a frozen, which means they just look at one slice and see if they see anything, or you can send it as a permanent, which means they look at everything to see if they see anything abnormal. I usually send it as a permanent because a permanent is just more accurate than a frozen. So it takes 5 to 7 days to come back. Now, with that said, I've had two patients where we have actually seen breast cancer after we have sent things to pathology, and it comes back after 5 to 7 days. By then, you've already done the breast reduction, right? So then it's a conversation of what do we do now in terms of treatment. I'll send them to a breast surgeon. We'll have extensive conversations about that. But in general, I've never been in a situation where I've been in a breast reduction, something is so abnormal, I have to stop. Now, with that said, if something was so abnormal that I found on the breast reduction, like let's say an odd mass, and I was like, gosh, what is this? I'm very concerned. I send it to the lab. I might stop. So it's all about safety again. Like I said in the prior video, everything is safety, safety, safety. So if there's any indication I need to stop because it's just the best thing for the patient because we need more information, I will stop. But I've never had to do that in many years of doing this and doing many, many, many breast reductions. Okay, I hope that answers the question. Y'all have a good day.